Hey everyone, it's Jeremiah from Alamance Battleground. We're back with another video as part of our 250th anniversary virtual event. Now, in the Battle of Alamance, there were scores of people killed and wounded on both sides, and Governor William Tryon, understanding that he was going to be undertaking a military campaign and was probably going to take casualties and inflict casualties, he attached medical personnel and surgeons to his army and gave them officer ranks within the militia. And we actually have a good bit of documentation about what they were doing, and we know quite a bit about the nature of the wounds of certain militia members. And here to talk with me a little bit more about medicine and surgery in the 18th century is Alamance Battleground volunteer and medical interpreter Mike Williams. Mike, thanks for being with me today.
Oh, it's a pleasure to be here.
So help give our viewers an idea of what the status of 18th century medicine and surgery, especially on the battlefield, is in 1771.
In 1771, it was the midst, medical thinking was in the midst of a crux, to so speak. They had gone away from the old humoral theory to much more improved stimulation of the nervous system as being the cause of illness and disease. They just fought a world war with the French, and the military knew that medical people were essential. Unlike so many other wars, they had to reinvent themselves every time. So Tryon, because of the experiences of 7 Years' War, French and Indian War, knew the medical personnel they needed. And the doctors of that time, while if you look at the theory of medicine at that time, a lot of people just are basing their beliefs on movies and stories and this and the other about doctors were incompetent butchers. They cut off arms and legs at whim. They didn't really know what they were doing. They were just carving away on the human body. And that does a disservice to those doctors, because while their knowledge was not as good as ours, they did not know what germs were, they did not know what bacteria was, but they knew that dirt equated illness. They didn't know exactly why, so they would do everything in their power to save lives. As far as amputations, that was the last resort. That was the thing that they did when they had no other option to save that person's life. And yes, it was difficult to take a man's arm or leg off during that time period, because they didn't put him to sleep. So they didn't have any way to replace blood that was being lost during the surgical procedure. So some people did actually die from surgery, but more lived, rather than just not doing anything and letting the results of the wound happen.
Mm-hmm.
Even today, doctors can't save every patient. You can only do the best you can to improve your chances for survival, and then let nature or God take its course.
Mm-hmm.
I make a little joke of it when I'm talking to the public about it. I said, they call it medical practice. They sure don't call it medical sure thing.
Mm-hmm.
So.
Yeah, there is sort of a public fascination, or a morbid fascination with surgery and amputation specifically, because it is such a traumatic experience. But because it is traumatic, the 18th century physicians know that, and so they're quite eager to avoid it.
Yeah, there were two difficult patients, or there were two difficult people who were having a difficult time in a surgical theater, the patient and the doctor, because you can imagine what kind of nerves a man would have to be operating on a person who is feeling everything you're doing to him and screaming at the top of his lungs and resisting, trying to fight off while the system's holding down. That was the brutal reality of surgery in those days. And it had to take a toll on the doctors as well as patients.
Yeah, certainly so. And so, obviously, it stands to reason why you would want to avoid that at any cost. So, besides surgery, what makes up the job and the duties of an 18th century medical profession in a military setting?
Primarily the battle against disease. Contagious diseases took more lives than any battle injuries in most every war of history, up until about the Russo-Japanese War of 1905, which shows you how modern it was, that they finally devised devices that could kill faster than Mother Nature could. Because anytime a group of people get together, as we experienced with the coronavirus, you have a contagious disease, it gets spread around fairly quickly. And these people had nothing to stop, say, even common diarrhea. We can go and get something at the drugstore and slow that up a little bit, but these people didn't have that problem. didn't have that ability. So diarrhea, malaria, influenza, everything could basically debilitate your army.
Yeah, and under the rigors of a military campaign, and considering the proximity that people are in a military
Exactly
campaign, disease can spread incredibly quickly.
And it you wouldn't think this would be a problem, but people just didn't understand in those days that taking the outhouses and putting them upstream from where you draw your coffee water was not good.
Mm-hmm.
But it just never entered into their thing.
Yeah. Yeah. So, at Alamance Battleground, we obviously have a very well-documented military campaign, surprisingly well-documented for a militia campaign in 1771. And we know about the surgeons and the medical professionals, but after the battle, several of the wounded from Tryon's militia submitted petitions to the General Assembly asking for some kind of support, a pension of some kind, and they list, in some cases, the wounds that they took at the Battle of Alamance. So I would like to go through a couple different examples with you of some of these wounds. We'll talk about the soldiers and who they were, and then I'd like you to talk a little bit about what you would do, or what an 18th century surgeon would do if this person came across their table.
Okay.
All right, so let's get started with Thomas Carsley of the Carteret Detachment. Carteret was on the front line, and they they took very high casualties because they were on the front line, and their portion of the battlefield was closest to the regulators, and so they were under a relatively large amount of fire compared to some of the other detachments. And Thomas Carsley said that in the Battle of Alamance received 3 wounds, one through his belly, one through each arm, and in his right arm the bullet is lodged between the bones so that it cannot be cut out.
He had a bad day.
Yeah, we're going to hear about a lot of people who had bad days, and I should say, if you're at all squeamish about surgery, cutting, or anything like that, I would recommend that you go on to the next video at this point. But please continue.
The stomach wound is interesting because if it went through the stomach and did not cause any damage to his intestines, his stomach, anything like that, he was a very lucky individual. Because usually a torso hit from a gunshot is usually fatal, because there's no way a physician can spend a lot of time going in there, mucking about, trying to get that wound out. So we'll say that perhaps he had a grazing wound to the stomach. And basically all that would be just make sure that the wound is cleaned, any foreign objects are out of it that you can get to, and then apply dressing. Now, the interesting one is the bone, or the wound in the arm. There are 2 bones that connect the wrist and the elbow, the ulna and the radius. If a ball has impacted and gone into 2 of those, it would have been extremely difficult to do, because you're going to cause a lot of damage by cutting through the tissue, cutting through the muscles, tendons, possibly nerves, and getting that ball out. So again, doctors of that time, they were not morally opposed to leaving bullets in, because again, you got a bad injury that can be made worse by the surgery, because you're going to be moving a lot of stuff out of the way, you're going to be letting them bleed out, and again, you've got no transfusions, so the longer you muck around in there, the worse it is. What I would have done is I would try to dilate the wound, get anything out that I could reach, just leave the ball alone and let that wound heal. The key is going to be to keep abscesses from open, which is where the skin is healed over and bacteria is still in place in the wound, and it starts an infection. Because there were cases that I've read that people were suspirating wounds for years after they received it. Bone fragments would keep coming out, bullets would come out, pieces of cloth would come out continually. And if you didn't have a really, really good immune system, that'd take it.
All right, so let's move on to the next one. And this is not a member of the rank and file of Tryon's militia. This is a member of the governor's council, Samuel Cornell, who was a very prominent merchant in New Bern, one of North Carolina's wealthiest citizens, and a member of Governor Tryon's council, who was actually on the battlefield at the Battle of Alamance. And in a letter, it was written that Samuel Cornell received a slight wound in his thigh. So what would So what would a thigh wound present to an 18th century surgeon?
Mr. Cornell was lucky. If he took a wound in the leg, that was or the thigh, that's a lot of tissue, and you could have a through and through gunshot wound with no problem. Uh, the problem would have been if it had gone through the thigh and hit the femoral artery, which is a major artery that's on the inside of the leg. If that's ever severed, you got 3 minutes before you bleed to death. You really bleed out fast. So he probably had an outside wound where it damaged a lot of tissue. Now, tissue damage hurts. I mean, he probably was not a happy camper after he received that. And he could probably tell when it was going to rain from that point on. But as far as permanent damage, he probably limped a little bit, but it wouldn't have been that bad comparatively speaking to other injuries. Again, keep the wound clean, keep it open. If its tissue has been separated, you can actually put sutures in place, or like we do today. A lot bigger needles, a lot bigger material, but yes, you could actually sew tissue up. But it sounds like he just had basically a graze and a very shallow wound.
Mm-hmm.
Because if he did hit the bone or he hit the femoral artery, he would have had much more.
All right, now let's move on to another member of the rank and file, Isaac Reed of the Craven Detachment from around the New Bern area. Received 2 wounds in his right hand and 1 in his right elbow, which has entirely deprived him of the use of his right arm.
Yeah, that is one of the more difficult parts of 18th century medicine is they had no orthopedics. They had no ability to do repair joints, any tendons or anything like that was attached to the bone. If they were disattached, they couldn't put them back. So you saw a lot of injuries in joint areas where they would actually atrophy the muscles. They didn't do physical therapy. They would try to move things around and stuff like that. So the muscles would atrophy and then they'd pull up. And he would still have a limb, but it wouldn't be useful. And believe it or not, a lot of people thought that was much more preferable than amputation. Because again, maybe it isn't functional, but it looks normal. And if you go to a person and you see his sleeves pinned up, I mean, there's a different perception. Again, that was another reason the doctors didn't like to amputate unless absolutely necessary.
Mm-hmm.
But there was quite a few cases of people who had damage to joints and such like that where they had such atrophy in the wound that it was never functional again.
Yeah. And it's important to note here that of 61 wounded that Tryon accounts for, we have documentation for about 30, which is to say names, and in most of those cases, the nature of the wounds. And in all of my research, not a single one of them mentions having a limb cut off or amputated. Several do mention losing the use of a limb. Now, there's a couple different things at play there. These petitions are submitted in the winter of 1771, so we're already several months past half a year past the Battle of Alamance, and so if you were going to die from infection after an amputation, it would have happened already, and so this is cases where people have sort of gotten past that big hurdle of surviving infection. But then it also speaks to what you're saying about how amputation is something that is not automatic with a lot of these wounds.
No, it was a terrifying operation, but that was actually, to put it in the 21st century terms, that was actually a break glass in case of firefighting. You did not do it unless you absolutely had to.
Yeah, good way to describe it.
Mm-hmm.
All right, so I've got one more for you here. Thomas Bryant of the Orange Detachment. And Thomas Bryant has sort of unfortunate distinction of being in service for the longest amount of time. And that is because hospital time was counted as time in service. And Thomas Bryant is ultimately in service for about 160 days after only being enlisted for about 2 weeks before the Battle of Alamance. So it gives you an idea of how long he's in the hospital, and here's what lands him there. Thomas Bryant had the misfortune of receiving, in the Battle of Alamance, 5 wounds. one of which in his breast has rendered him entirely unable to labor for a livelihood, being extremely weak and infirm with it.
Sounds like lung. His lungs was damaged in the chest. People did survive having gunshot wounds through the chest area as long as it didn't hit any major arteries or the heart or anything like that. They were rare. There were a lot of people that didn't make it off the battlefield with chest hits, but it sounds as much like he had some damage to his lung. It is a very, very slow thing to heal. It's prone to have a lot of infections. Blood loss is going to weaken him some more. So you have him, I would imagine that his illness would be somewhat like what they call consumption in those days or tuberculosis today. Tuberculosis is a contagious disease and it damages the lungs and it debilitates you. You're very skinny, lose a lot of weight, you can't do anything. It's the wasting disease, as he called it. And if he had one of his lungs damaged, he would look like he was wasting away to nothing because it takes so long to heal. Also, he would be prone to have any communicable lung disease or a cough, or cold, or anything like that. It would really catch it, take hold of him, and really get him down because his immune system is really bad. So he would have a really, really rough road.
And is that the type of wound that he's going to continue to have for the rest of his life, or?
I would say so. I don't think once you hit a certain period that it's ever going to improve. It will only slowly, gradually do it as you get older. Like everything else, it starts breaking down.
Which explains why so many of these records stem from petitions for support or pensions, because North Carolina does not have a pension system in place at this time. And in the 18th century, government care for soldiers is uneven at best when it actually does occur. Now, if you're interested in learning more about all of the recorded wounds and injured individuals in Tryon's militia that we know of, I'd like you to check out the link as part of this video. We do have our entire list that is going to be published on our Medium blog. And if you would like to learn a little bit more about 18th century, back when we have in-person events, Mike Williams is usually here interpreting 18th century medicine, both surgical and otherwise. So Mike, thank you so much.
Well, thank you for having me. I've enjoyed it.
And thank you so much for watching, and we'll see you again soon.